Hi, everyone, and welcome back to another episode of Chats with Your Advocate. I'm Tiffany James, co owner of Divine Wellness Partners, family nurse practitioner, and board certified medical advocate. I'm here with my sister, partner, and fellow advocate, Sondra Graham.
Hi, everyone. I'm Sondra Graham, licensed clinical social worker, mental health advocate, and co owner of Divine Wellness Partners.
So, before we get started, as usual, a quick disclaimer. This conversation is for educational purposes only. It is not medical or mental health advice, and it does not replace care from your personal care providers. Our goal is to help you better understand the system so you can advocate for yourself more confidently. So, February is Black History Month, and today we wanted to hold space for something super important: health equity, access, and advocacy in the Black community. This isn't just history. This is about how the past still shows up in our exam rooms, our emergency departments, and our everyday lives.
Definitely. And Tiffany, when we talk about health equity, we're not just talking about access to doctors. We're talking about who gets believed, who gets listened to, and who gets timely, appropriate care.
Absolutely. And historically, the Black communities have experienced deep harm within the health systems, right? Experiments without consent, unequal treatment, and longstanding mistrust that didn't come from nowhere.
Right. I mean, if you look at our history, we've got the Tuskegee Airmen experience, Henrietta Lacks. That history didn't disappear, it actually evolved. Today, those symptoms look a little different, but it can look like being dismissed, pain being minimized, or mental health needs being overlooked or even stigmatized.
And the impact of that is real. So, higher rates of chronic illness, maternal mortality, and delayed diagnoses. Also, burnout from constantly having to fight to be heard and fight for care. Now, how do these disparities show up today, right? As a
Mhm.
nurse practitioner, I often hear things like, I've been saying the same thing for years and nobody's listening. Or, no one ever explained this to me like that. Or, I didn't know I could even ask for that.
Definitely. And from a mental health perspective, chronic stress from racism, from navigating systems not built for us or by us, shows up as anxiety, depression, sleep issues, and trauma responses.
And I want everybody watching to understand and know this is not about individual failure. This is about systems, communication gaps, and lack of health literacy support.
And Tiffany, when people don't feel safe or empowered in those healthcare spaces, they delay care or stop getting it altogether.
Absolutely. So when we talk about advocacy and health literacy, it is power. This is where this comes in. Health literacy, advocacy. It doesn't mean being aggressive,
Right.
although it may be perceived that way. It means being informed, being prepared, and being supported in the right way.
Absolutely. It's about taking your power back. It's about understanding your diagnosis, your medications, your options, and quite frankly, your rights. It's knowing that you are absolutely allowed and should ask questions and request clarity if you don't understand it. That's your right.
Definitely. Definitely. And understanding that advocacy can look like bringing someone with you to your appointments, prepping your questions ahead of time, understanding your discharge instructions, or having extra support after a hospital stay.
Yeah, especially in Black communities where we've often been taught to just kind of push through, persevere, keep your head down, not complain. It's a big shift, but it's a necessary one.
Absolutely. And that push that we see in our community, it comes from years of what we just explained. And it's sad. We don't
Definitely.
have to deal with that.
No, we don't.
And so talking about empowerment, right? Practical takeaways. We want you to hear this clearly. You deserve quality care. You deserve explanations. You deserve respect. We're not asking for special treatment. We're asking for standard of care.
Correct. And it's okay that you don't know everything. You're not expected to. That's why advocacy exists. That's why we're here to help bridge the gap between appointments and real life.
And start small. Write down your symptoms. Ask, what are my options? Ask, what's the plan if this doesn't work? It's okay. You can ask.
Absolutely. Everyone should have a plan A, B, or even C. And if something doesn't feel right, trust that instinct, right? Go with your gut. You're not being difficult, you're being proactive and you're protecting your health.
Definitely. And again, it's okay. It's okay to do that. Now, sometimes it won't be received that way from your care team. And if you have a provider, I often say this, that doesn't listen, get another provider. It's so important. Yes, everyone's busy. Yes, everybody's in a rush, rush, rush. It doesn't take long, a minute, 2 minutes to be able to just address the concerns that need to be addressed. This is your health, your journey. It's okay. Speak up. You're not alone.
Mm-hmm.
And at Divine Wellness Partners, this is why we do what we do, supporting people, especially those from historically marginalized communities, so they don't have to navigate healthcare alone.
That's right.
Now, we have clients, patients across all walks of life, socioeconomic status. We are here to bridge the gaps. Everyone deserves equity, access to care.
That's right. So, this Black History Month, we honor our communities by empowering ourselves with knowledge, advocacy, and support. It's the best gift you can give to yourself and to your health.
Definitely. And so, if this conversation resonated with you, subscribe to our channel. Share this with somebody who may be able to benefit from it as well. Help us spread this message.
And drop a comment below. We want to hear from you. Tell us what topics you'd like us to cover in future chats.
Absolutely. And until next time, be informed.
Be empowered.
And remember, this is where health literacy meets real life. We want you to know it can happen. Just have to push forward and advocate for yourself.
That's right.
All right, guys. Take care.
Take care.